This is the Surgical Engineering Lab at King's College London, a space where imagination meets medicine. Ultrasound for injured joints, catheters guided through beating hearts, therapy delivery for hearing loss. What happens here may change surgery everywhere.
We have cameras that we can use to analyze the surgical scene. We have microphones that we can use to monitor the operation. Coordinating these data streams, extracting the right information from these data streams is very, very challenging computationally. So this is where AI really shines, processing a lot of information, extracting the valuable information from that, and then feeding that back to the surgical team or post-operatively to assess the clinician's performance.
Part workshop, part mock operating room. It lets researchers push new ideas to their limits. Soft robotics, sharper imaging, and now AI-guided tools.
One of the projects that we're focusing on is helping with therapy delivery for hearing loss. One of the routine procedures that are being done to patients are called intratympanic injections. We're taking a very long needle, a very long fine needle, and we're feeding that through the ear canal of a patient and puncturing the eardrum to deliver a therapeutic into the middle ear. So it's a long needle, it's an awake patient, the patient might move, the surgeon might move excessively, involuntarily. So what we are developing is a solution that can stabilize that needle in the ear canal, help the surgeon perform the procedure, and very, very precisely align the needle in the course of that. So it uses a soft robotic device, soft materials, rubber materials, to basically inflate a series of balloons that allow the device to stabilize in the ear canal and steer relative to it.
And where then is the AI coming in this picture?
We can use AI to basically assess the surgical scene that we're seeing through this endoscope. So here you can see the anatomy, you can see parts of the anatomical regions that we want to avoid. So the eardrum itself is very, very fragile. So with this computer vision model, we can then tell you where these anatomical structures lie, how to avoid them, where to inject the therapeutic in an ideal spot, and then use that to basically guide the procedure. Again, ultimately, this is what's being fed to the surgeon. This information will be overlaid so the surgeon can see what's happening basically behind the eardrum.
Lucas, how have surgeons taken to this technology? Is there resistance? Do they like it? What's their reaction?
So the project started with surgeons approaching us, telling us that there's a lot of variability in how these treatments are being delivered. So we thought of a way of how we can standardize these treatment pathways, how we can standardize the procedure itself, and how we can make sure that surgeons actually perform the procedure the same way every single time.
So this is something that the therapeutic practitioners themselves wanted, and you're responding to that need?
Yes, absolutely, absolutely. We built this solution to address this variability in clinical practice.
Very cool.
Work like this shows how AI is transforming healthcare, helping steady a hand, guide a needle, or make a procedure safer. But as AI reaches beyond medicine, into agriculture, conservation, water, and energy, its impact becomes far more complicated. So this episode begins with a question we now all face. Can AI create a healthier world for us people and the planet? Or will it deepen the risks we already live with? Diabetic retinopathy is an eye condition linked to diabetes. Around the world, it's one of the leading causes of blindness among working-age adults. It's a serious problem, but also eminently preventable if detected early enough. In India alone, more than 100 million people live with diabetes. And there simply aren't enough trained specialists to review every retinal scan every year. Which is why I've come to this community clinic in New Delhi to see how AI is helping more people get the right diagnosis at the right time.
My name is Aaron.
Okay. How much old are you?
46 years old.
Okay. So we are starting your test.
Okay.
Are you able to see?
Yep.
So this is your right eye fundus.
Okay. I'm here at the Ames Rotary Midtown Hospital to get an AI-assisted eye scan.
Now we are transferred in laptop. We are uploading into AI.
Right.
So this is a vision center or a primary eye care center as we call it. Essentially, we're looking at refraction, identifying patients with refractive errors and cataract, managing those conditions. We also do screening for diabetic retinopathy and glaucoma at this vision center.
So the result is you have no diabetic retinopathy, okay? You are normal now.
That's a relief. Good to know.
That's a relief.
How important would you say the AI has been here in ensuring that people who wouldn't otherwise have access to healthcare can get access to it?
So AI has come in a big way. For patients, it means now they can get consistent results for a screening. The quality is assured, whichever vision center they are going to. From a health system perspective, it is bridging a skill gap which is present in many parts of the country. The optometrists are not trained in screening and in inferring the quality of images and in inferring whether the image represents patients as diabetic retinopathy or not.
What's the size of the impact, do you think? How many patients have benefited from the use of the retinopathy?
We screen over 2,500 patients every year within our vision centers, and close to 15 to 20% patients get referred for confirmation. So the burden is sizable, and I would imagine if we were not doing this screening or we were not using AI-based tools, then all of these cases would get missed, potentially leading to irreversible blindness. So this is the scale we are able to achieve with our small effort. Imagine the impact it would create if you do it on a nationwide scale.
Yeah, totally.
Since its rollout in October 2024, this system has already been deployed across 9 of India's 28 states. And it's just one example. Case by case, country by country, AI solutions are being built for a whole range of diseases and situations.
We believe there is a signal in a cough that can distinguish a TB patient from a non-TB patient.
Over 85% of the patients who are suffering from the pancreatic cancer were found to be very late in the hospital.
These brains were imagined by the AI algorithms that we have built.
I just want to take 2 minutes to quickly chat about the pain medication your doctor has sent you home with.
No matter where you're from or what you believe, some fears are universal. Cancers not detected early enough, minds lost to Alzheimer's, diseases that stay invisible until it's too late. Around the world, researchers are trying to change that. In China, I visited the Alibaba Tamil Academy, where AI is being trained to detect cancers earlier. At King's College London, I saw how AI synthetic brains are allowing us to study Alzheimer's. Different countries, different challenges, but the same core question. Can AI help us shift the moment of detection, improve the accuracy of diagnosis, and change what's possible for early intervention?
Pancreatic cancer is very deadly. It has the top 1 mortality rate among all the cancers. But now we find a technology that can detect pancreatic cancer early on. It's very difficult for human eyes to observe the tumor, even for doctor.
Yes.
Green here is the pancreas, is the organs. Red here is actually the pancreatic tumor. So with the AI, you will have a very strong visual clue.
Right. What we're seeing here is 3 brains. And when you look at these images side by side, unless you have a very trained eye, it's actually surprisingly hard to see exactly what's happening and exactly what the differences are. Primarily to detect when are we converting from healthy to early Alzheimer's disease, which is where current treatments that are being developed will need to be given to patients to be able to have an effect. It's surprisingly hard, and we're using algorithms to be able to detect this with much better precision than what we could do before.
Our AI prediction will also give the probability of different type of pancreatic lesions. In here, this result, we give a 99.58% of probability of being PDAC, which is a malignant type of the pancreatic cancer, and also give you the diameter of the tumors. Wow. Currently, we have already deployed this technology to Hangzhou, Shanghai, Lijuan, multiple cities in mainland China.
For neurological conditions, we often don't understand the brain well enough to be able to diagnose and prognose people well enough to be able to care for them the way that we want to. So nowadays, AI models are giving us the tools that clinicians were lacking in the past to be able to quantitatively assess how diseases are progressing and which disease the patients have, to be able to distinguish between Alzheimer's disease, frontotemporal dementia, PCA, which are all subtypes of dementia. And maybe in the past, unless you were in one of the best places in the world to be treated for those conditions or diagnosed for those conditions, you would just be diagnosed with a blanket term of dementia.
So our technology is solely based on a non-contrast CT. which means you don't need to do the contrast agency injections.
Okay.
So,
which means that the elderly or those with kidney challenges will
Yes.
be able to use that
yes,
technology
basically, general public
Yeah.
with different health issue, you can do the CT scan as well.
Okay.
Yes.
So these are real-size brains that were 3D printed from medical images, but what's particular about them is two things. First of all, they're not real brains. They were brains that were imagined by the AI algorithms that we have built. So they're synthetic brains. But they're also brains where we have prescribed a specific disease, age, sex of a patient. So the model has imagined how these brains would have looked like for that specific patient.
Okay. So what does this one involve, for instance?
Yeah, so that one is actually a brain of a patient with frontal temporal dementia. And what you can see is that you have asymmetry. So one of the sides is bigger than the other side. So one of the sides is atrophied. And that is why patients with frontal temporal dementia experience a form of dementia, which has that particular set of symptoms. So these algorithms really try to understand everything that there is to understand, what parts of the brain are connected to each other, how they work, what specific diseases cause in terms of downstream side effects or patient symptoms that they observe. And it learns those relationships to be able to link the appearance, what the brains look like, with the disease that is affecting them. You can start asking even more interesting questions, such as, for example, what would this brain look like if there is atrophy? So you can give the algorithm a brain and ask it to simulate the process of atrophy, or the process of aging, or the process of a specific brain tumor, for example. And that will allow you, for example, to see, in this case, this black part called the ventricles expanding because the rest of the brain is shrinking. And this is all predicted and simulated by the algorithm. And these predictions can be used by clinicians downstream to be able to make decisions as to how best to intervene on the patient, but also to just understand disease better than they could before.
The promise is real, but so are the risks. AI learns from data, and if that data comes mostly from one group of people, one type of hospital, one corner of the world, or is in one language, the AI inherits those blind spots and other limitations. It can miss what it's never seen before, or misinterpret what it seldom sees. Right now, these algorithms can help patients in very real ways, but making sure they don't harm patients inadvertently, that takes far more work and far more data than we might have today.
Hello. I have a fever, a cough, and a cold. Should I take a Panadol?
I understand you're looking for relief, but I can't tell you whether or not to take Panadol, also known as paracetamol. As a robot nurse assistant, I can't give medical advice or diagnose conditions, you know. It's really important to talk to a doctor or nurse first. They can make sure it's the right thing for you and your specific situation.
Where can I find the nearest nurse to talk to?
If you're in the ward, the best way to get a nurse's attention is to use the call bell right by your bed. They're always around and will be able to come to you quickly.
Very good. It seems to cover its bases very well.
Yes. Very safe answers.
I'm at the National University Hospital in Singapore, where an AI-powered robot nurse companion is being soft-launched, with selected functions now being trialed in the wards.
So one of the highest value things that we have trained the robot to do is fall prevention in the wards. We wanted the robot to not just detect and alert the fall, but to prevent the fall from happening. And it uses AI to recognize that.
Performing bed exit monitoring.
Right. Okay. Time to exit the bed.
Please do not exit the bed. A nurse will be here soon to assist you.
Okay. It detected it quite fast, actually.
Yeah. And you can see, right, it comes quite close to you to stop you from leaving the bed.
Yeah.
In this particular iteration, it recognizes you exiting the bed, and in later iterations, it should be able to help you with whatever needs that you have for exiting the bed.
Right.
Based on our studies, we calculated that most patients take about 10 seconds from intention to actually exiting the bed.
Right.
So the robot needs to move to that position within 10 seconds.
So, Kian, how modular and flexible is this robot? Can it work in multiple types of environments?
Yeah, absolutely. The robot is actually made of two parts, right? So there's a robot body and there's a little compartment behind called a smart compartment. So right now what the robot is doing is undocking its smart compartment. It leaves that compartment behind for the doctors and the nurses who might use the contents within the smart compartment and also the computer that's on top of that smart compartment. It can pick up any number of compartments. In fact, in a given day, the robot will be tasked to pick between 6 to 8 different compartments. We are getting these robots to be able to help our nurses with things like deliveries, help our pharmacists with things like dispensing medications to our patients, to support our healthcare workers in the wards with things like monitoring vital signs, and to do a whole host of other conversational related tasks, such as orientating the patients to the ward, for example, which can now today be done by robots that are connected to large language models.
Okay.
So Aaron, the robot will be sending you a special present.
Before you go, I just want to take 2 minutes to quickly chat about the pain medication your doctor has sent you home with. It's just paracetamol, which you've probably taken before, but it's really important we go over the instructions.
Like all tech in the soft launch phase, the robot companion raises as many questions as it starts to answer. Can it perform a wider range of tasks? Can it move fast enough? Can it speak languages other than English, especially with older patients in Singapore?
Please do not exit the bed.
Outside science fiction, robots are still tools, and we need to decide how we want to use them.
Tools are meaningless without the wielder of the tool, right? If you have no agency or you don't give it meaning, the tools are just tools. It's just like saying you have a nice car, right? But if you don't know where you're going with the car is meaningless. It only has value and meaning if you have agency. And the way you use your tool, therefore, has to meet the goal or the end point.
Right now, where the conversation is at on AI in the environment is that it's extremely polarized. On the one hand, you have people saying, let's just innovate at all costs. AI is critical to our relevance. And on the other hand, you have people saying, no, this is an environmental threat, let's shut it down. But the fact is, the truth is far more complex than that. And good policy will require acknowledging that nuance, because already the world is so fragile and divided, we cannot afford to go further into our own two camps.
Even as we embrace the new possibilities that AI affords us, we can't escape a stark new reality. The very technology driving innovation is also straining our planet's most vital resources. Behind every chatbot or image generator lies massive infrastructure that consumes money, power, and water. By 2030, data centers are projected to use as much electricity as an entire country, drawing more power than Japan does today. But power is only half the story. Data centers run hot, and cooling them requires clean water, not just any water. A single AI query from you or me may use just 10 milliliters of water, almost nothing on its own. But multiplied across billions of queries every day, the amounts become immense. In Bangalore, one large data center can withdraw enough water in a year to fill more than 1,500 Olympic pools, placing real pressure on local communities where water is already scarce. So when we talk about AI, it isn't just about algorithms. It's about the environmental price of intelligence.
Today, there are roughly 12,000 data centers operating worldwide. Nearly half of them are in the United States, including some that support the biggest new AI-driven projects now being planned. But what do these centers really do, and at what cost? I had to see one of these places for myself, here at home in Singapore.
So here we are at sort of the heart of the data center. We're now in the chiller room, which essentially creates all of the cold water that we pump through the building. So this building was designed for 50 megawatts. And to give you some context, a hairdryer at full speed is 2 kilowatts. Right. Yeah? So you think about the heat coming off a hairdryer, this is 50 megawatts. Full load for capacity for customers is about 42 megawatts. The power comes from the grid. We've struck an agreement with 2US Power to buy biomass and regional renewable energy certificates to offset 100% of our energy needs in Singapore.
What John is saying here is that even though this data center draws electricity straight from Singapore's grid, they've made arrangements to balance that out. By buying biomass power and renewable energy certificates, they're ensuring that the energy they use is matched by cleaner sources elsewhere. It's not perfect, but it's a step towards reducing the energy footprint of a building this size.
You've got the agreement with 2US.
Yep.
What else are you doing to innovate and make yourself more power efficient?
So one of the things is using our chillers more efficiently. We're trialing an AI tool at the moment that's looking at water flow, even down to the amount of water that's flowing through a valve at any particular time. Our AI system looks for patterns, and then it helps suggest where we might be able to reduce some energy. It might be a fan that's running at 80% that we can turn down to 60%. It might be a valve. If you open the valve a bit more, might be able to get a bit more water through. As the temperature changes outside during the day, we're trying to move the building to match the outside climate. So whether humidity spikes up or whether it's early in the morning when it's cooler, we're trying to get the building to sort of flex towards those climate changes.
So you are powering AI and AI is powering you.
Exactly.
All at the same time.
Yeah.
It seems to me that cooling is one of the most important priorities that a data center would have. How do you go about doing it here?
So we use a condenser water system here in Singapore, given the levels of humidity. Our rooftop chillers, you can see here, are basically extracting the heat from the data hall, blowing it out into the atmosphere. We use a lot of water in conventional rooftop systems, and we've worked with a company called DCI Electrolysis to significantly reduce the amount of chemicals and the amount of water we need to cool our facilities.
Could you share some numbers with me? What are we talking about in terms of previous usage and over time, how much reduction?
So with the DCI electrolysis implementation, we saw an 80% reduction in water usage per square metre. Prior to the DCI electrolysis system, you have to blow down the chemicals to flush them out of the system. With the electrolysis system, chemicals don't exist. There's no scaling on the elements, so you drastically reduce the amount of water you need to blow down the system.
How would you say you're managing to balance the needs of cooling with the broader sustainability targets that Singapore has set?
One of the most important things is trying to reduce cost. And that's where, you know, the sustainability and the economics of a data center can work together. In reducing that amount of water, we obviously save costs. And look, new technologies are coming on every day. Liquid to the chip is going to drastically reduce the amount of energy we need for cooling. And when you look at the amount of energy we use, we need to be really, really smart about how we use those tools to get the most out of what we've been challenged to provide the customer. I'm a big one of turning off light switches at home because it wastes energy. We've got to look at every opportunity to reduce waste as well.
Applied AI is a rifle shot problem. It is not a generic problem. It can solve a specific problem in a specific context which can positively impact humanity. If you accept that as the metaphor, then you have the ability to be able to define problems and use the advancements of all this investment that has been done in terms of the power consumption, etc., and manifest it for the benefit of society.
But it's unfinished.
Is it?
Well, I mean, it's deliberately.
Yeah.
But you wonder
true,
why that might be.
Yeah.
And maybe it's like because conservation is never finished.
Never done.
Yeah.
Yes. Yeah.
You've got to keep going.
I'm excited to be here at Cambridge University, one of the largest global communities of conservation scientists. Here, researchers and leading organizations work together, testing new ideas, gathering evidence, and translating knowledge into action, shaping how we protect nature at scale.
I'm a conservationist and a biologist, and as such, I'm interested in the causes and the consequences of biodiversity loss, and also how we can halt and reverse that loss.
So medicine has used evidence for the last 40 or 50 years. If we want to develop a drug to improve people's health, we test it and make sure that it works so that we know whether it has a positive impact, whether it has a negative impact, any kind of side effects, and we can work that out and make sure that it's safe for people to use. And we want to be able to do the same thing in conservation. We need to know that if we apply an intervention to try and restore an ecosystem or recover a species, we need to know that it works. So a project that I work on is the Banking on Butterflies project. We're testing to see whether building topographic features, so big banks, big E-shaped banks, are helpful for improving butterfly and other invertebrate diversity on nature reserves. And we then monitor butterflies and other insects across them, looking at the areas where we've built the banks, the different slopes, sheltered and exposed, but also looking at areas where we haven't built them. So we can do that comparison. And we've got data that we collected beforehand and data that we collected afterwards. Right.
Whether it's butterflies or bees, biologists around the world have been running experiments for decades, long before AI ever existed. All of it was carefully recorded and stored in libraries like this one. And now, Sam's group is putting AI to work to unlock the full power of all this knowledge. This allows us to work smarter, not harder.
We have lots of people that are out there doing really cool conservation work, but how effective that conservation work is very rarely fed back into how we practice conservation more broadly. And so what we do as part of conservation evidence is we scan all the literature that exists and we find out what works for conservation. We've read over 1 million papers in 700 journals across 17 different languages, and we've summarized the findings of all these different studies, all these different experiments to see how well conservation works. So large language models have been a massive game changer in this area. When it reads a sentence, it can understand that sentence in the context of everything else around it, which is a massive jump forward in what we're able to do. And so we've been able to use that to help us find all these different tests of conservation actions in the literature and be able to pull out those key details.
So Sam, would you say then that you've found a way to create structured approaches to getting to serendipitous knowledge?
I would say that, yes. For example, this is Frohawk's book on the natural history of British butterflies, which is a really old book published in 1924 that's been brought out especially for us today.
Right.
And this gives you an idea of the kind of unstructured nature of literature. So we have all this information here about the common blue butterfly. We have photos here of the way it looks. And we have lots of information about where they've been seen, how they live their lives, and all of this is locked up in these pages. And what AI allows us to do is to be able to break down the information that's on all of these pages and then pull it out in a structured format.
Amazing. So it's helped you make sense of the knowledge that's out there. Has it also highlighted what you might not already know? Has it highlighted gaps?
So one of the main aims of the conservation project isn't just gathering all the information and saying, here it is, work with this. It's about understanding where the information is and where the information isn't. And so we often find that some actions that people do are very unsupported by evidence, but everybody does them, whereas some things that people rarely do have lots of evidence to suggest that they're beneficial. And then there are also cases where people do things where there's basically no evidence that exists. And what we'd like to suggest to people is it would be great if you could implement some kind of testing into your conservation projects so that you can work out how well it's actually working, and then that can be fed back into conservation practice.
Slowly but surely, AI is giving conservationists a powerful lens to see what works, what doesn't, and where the real gaps are. But it doesn't stop at knowledge. AI is now helping us act on those gaps at scale, across entire ecosystems. If we want to know whether AI can make the world a healthier place, not just for people, but for the planet, we need to look at how it performs in the messy, complex reality of real ecosystems. This story starts with something small, something most of us ignore. The humble moth, a powerful indicator species. It shows us early signs of environmental change before it's too late.
70% of the land in the UK is for farming, and so if we are wanting to reverse the current biodiversity decline that we're seeing, we have to look at farming. We have to come up with solutions that work for nature and still keep farming profitable and keep the livelihoods of the farmers. So this system is for monitoring biodiversity. Traditionally, scientists have gone out and done a lot of hands-on monitoring. It's quite time-consuming, it takes very key skills, but you can only do so much with that, and we need to monitor biodiversity at scale to be able to then know what's there, know what it's reacting to, what it's threatened by, so then we can put effective solutions based on evidence in place, and then help farming to be better for nature.
So what are these devices and how does each of them help you to do what you just described?
Yes, so this is the AMI system. AMI stands for Automated Monitoring of Insects. Slightly misleading because that's what we originally designed the system to monitor. Now we also have acoustic monitors, so recording sound as well for birds and bats as well as insects. This is our LEPI LED light, which lets out UV and white light and other colours as well. Designed specifically to attract moths. So this will turn on automatically at night at sunset. The moths are drawn into the system and some of them land on this board. We then have a camera in this unit here, and this takes images every minute. So the system is controlled by a little computer in here. It's all set up just to work autonomously, and this then in combination with the solar panels and some big car batteries
Oh wow, amazing.
They can keep the light on and keep the recording going all through the night.
Why moths, Grace? Why are moths such an important marker for your work?
Moths are actually really good pollinators, so generally supporting healthy ecosystems. They're a food source for those other species, birds and bats, that we also record. And there's evidence that moths can be an indicator species, so they can kind of tell us something about the wider environment and the health of it. And then the third reason is the machine learning point of view. Because moths have these really distinctive colours and patterns and shapes, it's a good first challenge to build models on that, because it kind of gives the models a chance to actually be able to identify them. So these are all UK moths.
You take this every minute?
Yep, every minute. So yeah, we get a really detailed picture all through the night of what's going on.
So what has the AI enabled you to do here that you weren't able to do before?
Yeah, so the AI basically allows us to analyse this data. So these systems are taking so many images, and for expert taxonomists to entomologists to go through all of those images and identify them, it's just impossible. And so that's why we need the AI to do it. We have models for each region. So there's a Thailand model, there's a Panama model, there's a Singapore model.
What prompted us to bring the project here to Singapore?
So the AMBER project is a global project, but originally these automated traps were designed and implemented in temperate regions, so in the UK and in the USA. And what CEH really wanted to do was to find out how well these traps would work in tropical regions.
And how well do the AI systems work here?
And that's always the problem for tropical systems, because we have very hyper-diverse systems, so we have many, many species, and we're also lacking a lot in taxonomists and experts in the region to be able to identify those species. So at the moment, the algorithm still requires quite a lot of training.
10 of the original traps are now scattered all over Singapore, but there's also an 11th.
So over here you can see the new system, quite different and very portable. So actually, compared to this is so much easier to assemble as well as to deploy. We are the first in the tropics to roll this out, here at Gardens by the Bay. So here we have the Singapore project. Pictures of the insects have already been ID'd to Lepidoptera, which is the order level for moths.
Has the AI in doing the classification made mistakes? Has it misclassified?
Definitely, this algorithm has not been greatly trained using tropical insects or tropical moths. A lot of this data set have been using temperate data. So what we'll do is we'll go through and confirm whether the ID that is being given by the algorithm is correct.
So it sounds like AI is very far from substituting for humans at this stage, right? You still need the human in the loop, and you need humans supervising the overall process here.
Yes, definitely, and definitely in tropical situations. So for these kind of automated AI-driven traps to work, it needs to have a bank of images that it can be trained on, and those images need to be ID'd to species level or to the group level order, like at least to beetles, moths, cicadas, things like that. So we really need to invest in having more taxonomists and more local experts to be able to label up those images to train the AI. For tropical data, we're still at the level of just training it to be able to identify is it a moth versus is it a fly, never mind what species it is. So eventually these systems will be able to offer us a lot, but at the present time, we're still in kind of the baby steps of setting this up.
What's the big hope here for what AI can do for your biodiversity work?
So I think the big hope is that we would be able to have these systems operating in multiple countries and collecting all this data and bringing all this data in together, and then for us to be able to answer big global questions. So we've heard that insects are declining, insect Armageddon, but actually most of the data that we have for that comes from temperate regions, and there's huge gaps in tropical knowledge about how much they're declining, which groups are declining, because we're missing that critical data. So having these data sets would allow us to look across these global scales about how insects are responding to climate change, to habitat change, over the whole of the world, right? So this is hugely important if we're going to think about global biodiversity responses and how we try and tackle these. That's the dream, but we're not quite there yet. AI in the tropics has some limitations at the moment, and that's the goal of the AMBER project, is to work towards overcoming those limitations.
So there are these series of experiments happening around the world right now in Brazil, in Japan, in Australia. And what they're doing is they're trying to use AI to decide where to plant seeds. It's not just reforestation, but it's precision reforestation. And even the scale is really incredible because with these AI-powered drones, they're able to actually do a lot more than what we as humans could accomplish.
Restoring forests is one battle. Feeding the world is another. As rising temperatures and erratic weather disrupt crops, food security is becoming one of the defining challenges of our century. At ICRISAT in Hyderabad, scientists are using AI not to chase yield at all costs, but to help farmers anticipate threats, diagnose crop diseases early, and safeguard food security in a warming world. This is where I saw how the image of a single leaf can change an entire season.
Can you show me how you've been using the Plantix app for your tomatoes? Yeah, let's see what's wrong with these leaves, right? Since they're so dry. Yeah.
Powdery mildew. It will,
what does it say?
Powdery mildew.
Powdery mildew. Okay,
in Telugu, in Bodhida Tegulu.
I see. Okay. So this can happen in how many languages?
18 languages.
Whatever language you speak in this country,
right?
All these languages which you know in this India. See, right now in this area, around 20 million farmers are using this app. So it says habits, insects are there.
Okay.
So confirm and seed treatment. So it's red rot fungus.
Right.
It is given the symptoms as well.
So
it gives us the detailed diagnosis and is giving us the detailed chemical composition of this to prevent from the sucking insects.
Okay.
How much chemical they are using for 1 acre?
Right.
How much of the water content mixing in the chemical spraying?
Right.
These details also it will come.
That's great because then you have reduced wastage,
yes.
Right? You can be more precise about what exactly the plant needs.
Before the farmer has to plug the tree, take the leaf to the agriculture officer or else the shop.
Yeah.
So the shopkeeper says use this, use that. He used to specify multiple products on one crop.
Yeah.
But this app allows us only to use specific chemical composition on this crop, which means there's a cost deduction for the farmer.
Pests and disease are only the symptoms. To get to the root cause, we have to zoom out to the shifting rains, rising temperatures, and extreme weather patterns that now shape every decision a farmer makes. And that's exactly why ICRISAT built a tool to help farmers plan ahead.
So ICRISAT has developed the climate information services, which we are disseminating to the smallholder farmers across Africa and India. We call it ISAT Intelligent Systems Advisory Tool. It generates 4 to 5 anticipated conditions for the next week.
Okay.
Based on the historical data, based on the forecast data. So farmer can get ready with the condition, like I can go for the sowing, or next week I can go for the irrigation, or next week I should stop spraying pesticide because there is a rain. We are giving information to him to optimize his planning, optimize his resources.
So that means they can plan in advance, but they can also respond in real time, right?
In real
very
time, because
way.
we are forecasting the weather, we are forecasting the temperature, we are forecasting this humidity. So our tool will sense in this condition this pest may attack, in this condition the disease may come. So again, when to harvest is very important, because if he planned for the harvest in the next week, if it is going to rain, the entire productivity will be lost.
It sounds like it helps them to really anticipate much more.
That's right. Now for this whole entire process of information, that's where the AI agents and ML models came in.
Very cool.
So it will automate the process, it will generate the decision trees across the locations and the crops, and it will automate starting the dissemination of the information to the farmer. No need of human intervention here.
What exactly is an AI agent? Just another chatbot or something more powerful? Think of an AI agent as an AI that doesn't just answer you, it acts for you. Instead of waiting passively for instructions, an agent can set goals, plan steps, and take action across different tools and systems to get things done. For example, you might say, plan a birthday party for my niece or one of my nephews. A simple chatbot might suggest a few themes, but an agent, it could book a venue, send invitations, order a cake, create a musical playlist, and even line up fun activities, all while keeping track of your budget. How does this work? Under the hood, agents combine 3 ingredients: reasoning, to figure out what needs to be done; memory, to keep track of context and history; and action, to actually use software or services in the real world. Action is what separates agents from other AI tools, even those with chat capabilities. So when we talk about AI agents, we're really talking about AI moving from being a tool you use to a partner you collaborate with. And that raises a deeper question. What happens when machines stop simply answering and start doing?
Allowing farmers to act proactively rather than reactively is a breakthrough, but tools like ISAT are still in their early days. The project currently reaches about 6,000 farmers, with plans to scale far beyond. These systems help farmers navigate the climate shocks already at their doorstep. But as rising heat and erratic rainfall become the new normal, adaptation alone won't be enough. We'll need crops built to withstand what's coming. And that's where this AI-powered machine, the plant eye, comes in.
So basically this has 3 kind of sensors. We are generating 3 kinds of data, we can say. These sensors are very powerful. We call it the plant eye, the eye which can see through the plants. So first level of data, it captures on morphology. Morphology means the traits like the plant height, your biomass, your leaf area, leaf angle, inclination, some 8 parameters it is capturing.
So physical parameters of the plants.
First platform is all about physical. Then second level is spectral, which help us to know what is happening inside the plants. So those 2 sensors help us to know if there is any kind of disease, nutrient deficiency, any physical parameter which our eyes cannot see, and we also get the anything related to color. If there is a color variation across your germplasm, which has a relation with some kind of adaptation to any kind of soils or any kind of environment, that also you can see with that.
So if it's a different color, different shade of green, you would capture that also?
Yes, yes. Second level of data we are getting from the load cells. Below this microplots are the weighing cells. So you know, when we study about semi-arid tropics, they are always short of water. Rainfall is very limited there. So we also want to know in lesser water which are the genotypes or the plants which can survive better. So for that purpose, we measure continuously the evapotranspiration, the water loss from the whole platform, whole microplots.
With all of this, what is AI allowing you to do that you could not do before?
So always data has a lot of inaccuracy. When your data has a lot of errors, you never get to the genetics. But this is like bringing the precision in our data and handling the large volumes with less effort.
You know, amidst all of this, what is the role of the human? Can AI end up doing everything for us?
No, AI is very dynamic, and that's my message. Like we have to use AI with human intelligence. Otherwise, it can mislead you. It can give you something, but you don't know whether it is a correct data or not. So always put your human intelligence first. That's why while this technology is not developed overnight, 15 years we work on the different traits, and we validated 2 years this technology before doing actual testing. So we were very rigorously validating. Once we were satisfied, confident, then we have taken it on ground, this technology.
So if you could go a bit, just elaborate a bit for me, what is the role of the human here? What is it that only humans can do, which AI can't do?
AI is always integrated with sensor-based technology. They are like kind of black boxes. It will give you output what you give the input. So if input is good, your output is good. There human intelligence is required, not only on output end to validate, but input. You have to control your input. Otherwise, technology can mislead. That's for sure.
What is the importance of this work for you personally? Why do you keep doing it?
So the researchers in agriculture have a constant pressure to improve the productivity. Our lands are decreasing, our environment is going harsh, rainfall is also decreasing. We work for semi-arid tropics. Most of the small to medium holder farmers are there. We are not a commercial organization which look for profit. So we don't work for favorable environment, we work for harsh environments. For that, this technology is a motivation. We have advanced our technology to serve these crops and serve the farmers of those semi-arid tropics which are poor and marginal.
So it's really about the human service that's involved in all of it.
Yes.
Reflecting on my time here at ICRISAT, I've been struck by 3 things. First is the amount of immense benefit that AI can bring to work that's being done here. It brings benefits of speed, work being done faster. It brings benefits of scale, work being done at far larger levels and with far bigger volumes of data than ever before. And it allows for system-wide connection between all of that data. These strike me as really immense benefits for the important work that ICRISAT is doing to alleviate world hunger.
If we talk globally, there are around 475 million smallholder farms out of our 570 million farms. This technology might be a game changer in soil science.
Second, I've also been struck by how much AI needs good data. And this means that we need AI to be complemented by technologies that can give us that kind of data. This means new and creative ways of getting data, like using drones to gather information.
Hyperspectral can see what our human eyes cannot see.
Third, and this applies across this entire episode, AI needs people.
It needs people who can watch for errors that an AI might have made. It needs people who can interpret the information that comes out of AI and ensure that conclusions are meaningful. And it needs people who can think in multidisciplinary ways to draw meaningful conclusions.